Okay, so before I get started, I just want to get a real quick idea. In this room, how many of you guys have employees? If you could raise your hand. Okay, about half, that's good. Does anybody have more than 25 employees? Okay, more than 50?
Right around.
Okay, all right. So that helps me a lot because the laws are changing for all of us, and depending upon our relationship to our employer, gives me an idea of what you guys will be more or less interested in. So let me give you a little insight into who I am. I actually spent 20 years working for major pharmaceutical companies. I spent most of my career working in medical oncology. One of my responsibilities when I was out in the field was helping clients who had been on chemotherapy. Cycle 2, cycle 3, cycle 4, the insurance stops the chemotherapy. And the patient needs to continue. Chemotherapy is very specific in cell cycle growth. So they would call me in and I would need to help with letters of medical necessity. And one of my responsibilities was getting those insurance payments going again. So I thought I was pretty good at knowing how insurance worked. I moved into New York. I became a vice president in an advertising agency, and I spent the majority of my time working with early stage development, stage 1 and stage 2 med ed for doctors. Don't know if you know this, but as science changes, the doctors need to learn the medicine, so when the drugs come out, they have a scientific background. So my responsibility was working on the educational pieces to help drug companies launch their new products. During that window of time, my husband became very ill. I refer to the next 18 months, 2 years as the swirling. I left my job. I was terminated by request. My husband passed away, and I got a lovely series of love letters and phone calls from the local hospital explaining to me that I owed them $200,000. Because you see, we had an 80-20 insurance plan that capped at $1 million, which I didn't know what that meant. Well, what it meant was up until the first $1 million, I have to pick up 20% of the tab. This was a small problem for a widow with 3 small children, and the big breadwinner had just passed away. So I took my Pollyanna approach to life, and I went out there and I said, you know what, I've learned how insurance works, now I really get it. I'm going to become an insurance broker, and I'm going to go out and teach people how to buy insurance that protects you against financial disaster, not causes financial disaster. And I would go out and I would talk to people, and I got all this pushback and no. And I was thinking to myself, I don't get it. Why are people so reluctant to embrace change? And what I came to understand is that the majority of us have no idea how much anything costs in medical care. We don't know how much a regular routine doctor's visit costs. Even if we take a prescription every month, we really don't know what the cash paying patient or what the retail cost is for that prescription. We have it's called price transparency. We don't know how much of a bill. So my husband's bill in the hospital, I asked for it to be shipped to me. It was a box. He was in the hospital for a couple months. And we're just going to ignore my phone. So my husband's bill arrived, and I asked for a copy of the medical bill. I had the billing department send me a copy of the bill. And the bill was this many pages, right? Do you know they were charging every 3 days to have his toenails clipped? Now, I don't know about your toenails, but mine just don't grow that fast that they would need to be cut every 3 days. So maybe there is some fraud in the system, but my bigger problem was even if I took that out, I was still looking at a pretty ginormous bill. So I started doing some research, and the more research I did, the more I uncovered, the more research I did. And now when I go out to do my open enrollment meetings with my new health insurance, I'm not giving a 2-hour voluntary, I'm not giving a 2-hour meeting where you can come or not come. I'm there for 5 and 6 and 7 hours. And I'm saying, you need to know this about insurance. You need to know this about insurance. These meetings just went on. And while the employees really appreciated what I was saying, and honestly, the employers appreciated it, but the employers really needed their employees to go back to work. So I started to say, well, I'm going to make some handouts. But the more I researched the handouts, the more it evolved into a book. So now I have a book, and just to let you know, I won an award, 2 awards in the last 2 days. The Great Northwest Book Festival said this is the best how-to book at its book festival. And the Great Southeast Book Festival, it's the 2nd best runner-up business book. So very pleased, thank you. No, using my social media. So what I'm going to talk with you about today is, the title of the book is Don't Buy That Health Insurance. It's not that I don't want you to buy health insurance. You do need to protect yourself against financial disaster. But I want you to become an educated health care consumer. So the word that in the title of my book is actually highlighted. And the reason it's highlighted is that we are very comfortable being very uncomfortable with our healthcare plans. We're accustomed to not being happy. We're accustomed to having claims not being paid. We're not happy with it, but we're accustomed to it. So what I want you to do is understand how you can get your own price transparency from your own providers. And when you understand how insurance works and you understand price transparency, you will start shopping for your health insurance in a very different way than you currently shop for health insurance. Now, I have an MBA from Penn State in and the first thing they taught us in finance is what? Fixed costs low, right? Fixed costs low. So there's two really important numbers with your health insurance. One number is your premium number. How much is your premium? Now, since most of you look like you're either employed or possibly buy your insurance, can I have a raise of hands if you know how much your monthly health insurance premium is? So this is a better turnout than most people. Now I'm going to ask you another question. How many people here went to the doctor 5 times or more last year? Okay? And how many people get explanations of benefits that are itemized so you know how your bills were, how your money was spent? Okay, so we've got a few. But for the most part, we have a bigger majority that really doesn't see that much of what's going on with their bills. So one of the things that this book does is it's a paradigm shift. I'm going to teach you to look at something you've looked at all your life from a different perspective. One of the analogies I use, and I use lots of analogies, is if you live at a lake and your house faces the lake and you've lived at that lake for 30 or 40 years, you have every tree memorized. Now you go around to the other side of the lake and you look at the lake, you see things you never saw before. It's a very different look, but you're still looking at the very same lake. And that's what we're going to learn how to do with our healthcare costs and with our healthcare decisions. Fair enough? Okay.